Welcome. Today we are discussing the Integrated Independent Physicians Network and what it does for independent physicians as well as its value to independent physicians. Today we are here with Larry Jones, Executive Director of IPN, and April Peterson, Director of Network Development, to lead this discussion.
Thank you, April. The IPN has come a long way since January of 2015, when a small group of independent physicians decided that it was time to take back the challenge that we see today with independent practices in being able to practice medicine in a more quality and cost-effective way. And our organization, Integrated Independent Physician Network, is 5 years old. And today we have 2 value-based commercial ACO contracts. We have 4 Medicare Advantage MSO primary care network contracts, and we are introducing, as of 7/1, a direct-to-employer program called Alliance Health. In the market, in the Central Florida market, you've got Advent Health, you've got Orlando Health, which are the 2 hospital CINs, and now you'll have Alliance Health, which will be the independent CIN. And what IPN has done, we now have well over 1,000 physicians in 9 counties, and we have actually grown into 11 counties, representing almost 1,500 physicians. Within that group, there's about 475 primary care doctors, and the balance of all multi-specialty, just about every medical specialty in medicine is represented within the network. But we also built a second IPA called Independent Ancillary Healthcare Network. And that's all the outpatient surgery centers, urgent care, imaging, lab, pharmacy, rehab, home health, DME, anything that is not owned by the hospital that is considered independent, that does not have, when they bill, facility fees attached that can run the bill up, and the coinsurance, the actual cost of care and the coinsurance for the patient up as much as 4 or 5 times more than less than in the hospital. So what does IPN really do? The challenge for physicians today, there are several big issues. One of them obviously is administrative burdens. Being able to practice medicine with full-time employees that actually provide the care. The administrative side of medicine and the referral, the authorization, the EMR, intake, dealing with all the payers, dealing with all the insurance contracts has become such a burden for doctors that an organization like ours, like IPN, has the ability to come in and help streamline those processes for a doctor. Getting paid a fair reimbursement rate has become a major issue. Physicians that are employed get paid about 40% more than independent physicians. That's just average. And in certain specialties, it's even greater than that. But unifying and using the strength and cloud of numbers really allows us to represent our physicians in a more effective way. April, you want to talk a little bit about the increased competition among doctors?
I would, but I'd also like to mention, too, that the employed physicians typically are not necessarily paid more in their pocket. We do see their fee-for-service reimbursement is increased because the hospital is leveraging a higher fee-for-service reimbursement. But at the end of the day, we have seen over the last few years now, the trend has been moving to independent physicians actually making more on an annual basis through value-based shared savings contracts that could really offset double, triple what the annual salary would be of a hospital-owned physician.
Absolutely. It's estimated that 50% of physician reimbursement in the future is going to be centered around what April cost fee-for-value or value-based care reimbursement. And we currently have contracts with both Cigna and Blue Cross representing just under 50,000 commercial lives. And it's the opportunity is that physicians still bill and collect under their own contract, their own fee-for-service, but at the end of the day, they get a pretty significant shared savings bonus incentive that can represent thousands of dollars and almost found money by their practices just for participating in a cost and a quality performance program with these major payers.
Well, this is what all the payers are doing. They are moving to this performance outcome-based kind of a value payment system. And so being involved in these commercial ACOs, we like to call them, at a shared savings with a commercial payer, it's, we laugh and say sometimes it's found money, but it's really money that's being left on the table.
That's
because
correct.
as healthcare morphs more into this performance and outcome based type of medicine, that's exactly what we see. The reimbursements are reflecting it every day.
Yeah, every day we are asked by our physicians to help renegotiate an old contract that may be anywhere from 3 to 10 years old.
Yeah.
And when we go to the payers and try to negotiate those fee-for-service rates, many times we can't even get it up to the current market rate for that specialty because they've been so long in getting that, in renegotiating that contract, that they'll give them a 1, 2, 3% increase. And it just continues to be a game. The way that independent physicians in uniting and joining together in these shared savings contracts can increase their reimbursement 30 to 40%.
Easily. I would definitely agree with that. And then when you take it over to the Medicare, because let's face it, we're in Florida, right? So we do have a large Medicare population in Florida. A good 50%, I would say, of the Medicare population tends to gravitate towards a Medicare Advantage plan. So we see that with Humana, Care Plus, Blue Cross, Cigna Health Springs, Simply, Freedom, all of these different Medicare Advantage plans. But we really see that shared savings, which is actually surplus on the Medicare side, can be significant for primary care physicians. And again, it is doubling, quadrupling their actual annual salaries. It is changing the concept of looking at fee-for-service reimbursement to a fee-for-value, meaning an overall approach to caring for a patient throughout an annual calendar year and then being compensated regarding that outcome.
Yeah, what is the real value of an IPA, a CIN like IPN? It's basically giving our docs the tools, the opportunity to participate in these programs that normally would only be available to them by participating with a hospital.
Correct.
And getting the short end of the stick because the hospital is going to take a disproportionate share of the savings and keep it for themselves and give docs what they term in their algorithms in their fee-for-service.
But Larry has said every day of his life that nothing happens in healthcare until a physician sees a patient, writes a script, or admits him to the hospital.
So why shouldn't physicians get the bulk of that shared savings? And in reality, it's all about uniting physicians. If you're an independent physician and you are not in an organization like ours, you are really missing the boat. And I like April's term, leaving money on the table. But also, there are more reasons to be it just than monetarily. These narrow networks are forming daily with these payers, with employers, and they're looking for high-performing practices that know how to transition from fee-for-service to fee-for-value and participate in these value-based contracts. And we give them the tools and the ability to be able to do that and the opportunities.
Yeah, we say every day that IPN, really our mission is to preserve and protect the independent practice of medicine. And we really do believe that is the solution to these ever increasing healthcare costs. If we can preserve and protect the independent healthcare, then we really all benefit as consumers, as patients, as independent physicians. I think healthcare in general benefits. And really what IPN wants to do is to help those independent physicians by helping to push more revenue to them, but also decrease some of their overhead. Like Larry mentioned, being in a CIN or an independent physician association, we also have the opportunity of helping them on medical malpractice, workers' comp, a variety of things when they're ordering table paper, whatever it might be, but just helping to reduce some of their overheads and increase their revenue.
Yeah, in summary to this podcast, really the value of an IPA, a CIN, an integrated independent physician network like the one we have in the Central Florida market, gives our physicians the tools and the ability to succeed in this new era of healthcare reform. Thank you.